Across Australia, people with intellectual disability and our supporters have called for better education and training for health professionals. Guided by our experiences, ideas, and informed by health professionals, advocates, and researchers, the National Centre of Excellence in Intellectual Disability Health has developed a position statement on what is needed next. Our message is clear. Every health professional must learn how to provide quality healthcare to people with intellectual disability, because everyone has the right to safe, respectful, effective, and inclusive healthcare.
People with intellectual disability have some of the poorest health outcomes in Australia. Many of these outcomes can be avoided with better access to high quality and inclusive care. People with intellectual disability are part of every community, and most health professionals will support people with intellectual disability at some point during their careers. University courses teach very little, if anything, about intellectual disability, and health professionals are not required to do training in this area. As a result, much of the Australian health workforce is not yet equipped to provide accessible and high-quality care to people with intellectual disability. This can and must change.
In centre consultations, better education and training for health professionals is one of the top requests by people with intellectual disability and is viewed by other sector experts as a key to improving healthcare. The Centre calls for a coordinated national approach to upskilling today's and tomorrow's health professionals. All health professionals must have the knowledge and skills to provide high-quality healthcare to people with intellectual disability. Education and training must be grounded in human rights and dignity, reflect the diversity and lived experience of people with intellectual disability, and value them as experts in their own lives, encourage self-reflection on attitudes and biases, and align with best practice and person-centred care. Education and training are how we turn good intentions into safer care.
All health workers need to respect people with intellectual disability and treat them with fairness and don't discriminate. I think education and training about intellectual disability should be compulsory, because health workers need to be able to treat people with intellectual disability with proper health care. I urge the government and health workers and the universities to take health care for people with intellectual disability very seriously.
We, the National Centre of Excellence in Intellectual Disability Health, make the following recommendations. Education about intellectual disability should be a compulsory part of tertiary education for all future health professionals. Health students should have more opportunities for clinical and non-clinical placements or other practical learning experiences that allow direct contact with people with intellectual disability.
People with intellectual disability and their support networks should be actively involved in the design, development, and delivery of intellectual disability-related education and training. Intellectual disability training should be compulsory for all health professionals who work in public hospitals, public outpatient services, and public emergency services.
Peak health professional bodies, specialist medical colleges, and government-funded health services should provide and promote intellectual disability training and continued professional development opportunities among their members and staff. Where specialty training is available for a health professional, intellectual disability should be included in the core curriculum of that specialty training program. More high-quality training about intellectual disability should be made available to the health workforce. This should include continued professional development opportunities and pathways for advanced or specialty training for health professionals who wish to specialise in the care of people with intellectual disability.
Health professionals should be given the support they need to put their training into practice. This includes giving health professionals the time and resources they need, such as fair payment for longer consultations and access to specialised teams to support their understanding and practice.
Change begins with education and training. By empowering the health workforce with the right knowledge, skills, and resources, we can build a future where everyone can access safe, respectful, effective, and inclusive healthcare.